situation which we are facing in the society. And when we are facing in the society, we know that what is the problem we are facing. The problem what we are facing is what? The most important is the stroke cases. Every minute there is a stroke patient. Every minute we see is a stroke patient. And approximately only 30 to 40% are survivors. But those who are saying 30 to 40% survival, now the quantity and quality has raised. Because the question is now bypass surgery, stenting in Moya Moya, STCA, bypass stenting has been done very nicely, vascular anastomosis have been done. So even if you reach the hospital 72 hours before the stroke and if it's in the proper hospital, what we call a stroke hospital, right? Like what we have it in Karat. It's a stroke hospital. It's a stroke hospital. Thank you. The most difficulty what we face in your treatment is non-planned treatment. Any treatment what you are planning for the treatment of the patient is non-planned. Because now when you speak about the spasticity, how it occurs. Well, first, they say death of the neurons. Brain में neurons का death हो गया. The primary neurons which are responsible, the primary trace, the pathway, the road which was responsible for to and fro of the signals has been disrupted. यानी वो signals खत्म हो चुके हैं. The membrane potential, action potential has given up. There is no neurochemical exchange. There is nothing inside the brain. So when we have nothing inside the brain, what do you come to know? There is no movement. So most of the cases we see, to make it more, I don't know. Yes. हाँ. So understanding the mechanism of post-stroke spasticity, we understand two factors. What? spasticity is a common complication following stroke affected people. So approximately 30 to 40% of the survivors suffer from what? Spasticity. It is characterized by the increase of the muscle tone, stiffness, and involuntary muscle spasm. This is called contraction. Right? So this is the most difficult part we are going to face. Spasticity significantly impact the mobility and functions and quality of life. So the most important part of spasticity is destroys your life. It makes you dependent, and once it comes, it becomes very difficult for you to recover. So the most important part which we understand in spasticity is to break the part of spasticity. Now to break the spasticity, Walid, can you hear me?
They're not clear. In between, it is going and coming.
Now?
Now it's audible, but what happens when?
Still it's not audible?
Yes,
Yes, sir.
audible, sir. Yes.
Actually, I'm eating my snacks actually.
Sound nothing. Constantly. Sir.
1 minute.
Okay.
Thank you so much. I hope now my voice is clear.
Yes, sir.
1 minute, there's a phone call. Understanding the underlying mechanism of post-stroke spasticity is the most important part. You understood?
Yes, sir.
and is a crucial for developing effective treatment and tailoring the treatment strategies. This presentation will explore the development of spasticity, focusing on the disruptions of neural pathways and discuss the innovative rehabilitative techniques. So there are many techniques which can be used for the rehabilitation of the patient. Most is non-invasive brain stimulation because it is the only pathway by which we know. मनीष तुम एडमिट नहीं कर रहा लोगों को
कर रहा हूं। कौन बाकी है? कोई बाकी नहीं है सर। सर एक भी पेंडिंग नहीं है सर।
नहीं है
नहीं सर।
अच्छा सॉरी so this is the important part which we understand here. Then we must understand normal pathway means is very easy to understand. एक बार stroke हो गया, रास्ता खराब हो गया, communication is disrupted. It's just like a storm in the city. The communication between them is disrupted, and once there is a disruption, it's very difficult. So until the communication is established, what is the problem? You have to re-establish the communication. Now, if you don't re-establish the communication, you are going to suffer. What you are going to do? You are going to suffer. So when we speak to post-spasticity, it's commonly neurological condition. Now you have to understand it's not a physiological condition, right? It's a it's a neurological condition. What it is a condition?
न्यूरोलॉजिकल कंडीशन।
So is defined as what? Bashir, close out this one. Mike, neurological conditions characterized by the increased tone and involuntary muscle spasms. Right? It is characterized by involuntary muscle spasm. Yes. Number cut here. So it arises as a result of damage to the brain, right? It arises because of the damage to the brain, especially the corticospinal tract following a stroke. So there is called a corticospinal tract. These are called the motor pathways and the sensor pathways, from which you understand what is the problem. The same situation arises when you have a chronic pain, acute pain. By giving blocks and all, you alter the signals. The signals are altered, but the problem is not solved. Osteoarthritis pain is resolved for some time, but the degenerative changes, anything is not resolved. So whenever you speak about any disease, what? You have to speak about the neural basis. यानी brain से उसका basis कैसे बनता है. The damage is inside the brain, the recovery also has to come from the brain. And so if anyone is thinking that by doing this, by making too many experiments, the patient will recover, you see this is a patient, right? Do you see? We gave it what? Test it. Now it is what? Great for spasticity. And here you see there is a foot, this one drop, this drop. So the condition is very bad. So even if you study all the theories and if you don't know how to recover the patient, can the patient recover? No, because the pathway has to recover for anything. Because now if you slap yourself and you see the pain is reduced, अब नीचे गिरते धड़ाम से फिर दर्द कम हो जाता है. Why? because the painkillers are inside the brain. But when these painkillers, the information when it is processed inside the brain is altered, the painkiller manufacturing reduces. And when the painkiller reduces, you have a severe pain. When the capacity of the body goes beyond acceptance, we try to resolve it by giving painkillers, rest, and everything. So after some time, you'll see this is what resumed. But here the problem is once you develop a grade 4 spasticity, grade 2 spasticity, Radhu Baba, it cannot but recover. It cannot
Recover.
So if you want to really learn about the recovery of pain, paralysis and all, I was working in KIMS, right? We were so helpless in seeing the patients. We said this is all what we can do. We can preserve the arteries so that there is no deficit. All mechanism which we have developed in neurosurgery, neuromuscular anastomosis, micro-ultrasurgery, sahastra netras, what is called micro-ultrasurgeries, redefining at 0.1 mm artery, connecting and switches of the arteries. Why? So that there is no deficit. Because once there is a deficit, there is no recovery. Now the problem here is that we are saying there is a recovery. Because if you see my videos, you'll see 70 to 80% of the people which comes to me, they get recovered. But then again, if they don't maintain properly, they don't recover. And that's what the white truth we have. The truth is that we are playing with the life of the people by non-counseling it in the proper way. People were saying yesterday that at the age of 78, spine surgery cannot be done. Fine. The patient is having a cardiac stroke. Fine. There is absence of kidney. Fine. So we has operated that case yesterday. Today it was operated at KIMS Karad. And it was my patient from Pune. He was Sumta Bhattacharya, Sumta from Pune, one of our Zoom class colleagues. Everyone was worried that, sir, I don't want to operate. I don't want to operate. The anesthetists were not clearing clearance. I was standing behind the patient and I said, you can operate it. There is no problem. The creatinine is only 1.3. Nothing will go down. When kidney has been managed for 65 years, it will take care. Patient will overcome. So this surgery cannot be done, that cannot be done. It's okay. This can be performed. Open it, remove the disc, and no need to put fixation. So are you sure? I said, I'm 100% sure. And the surgery was successful today. We have done 3 surgeries and every surgery was successful in Karat. What surgery? It was 15 lakh to 20 lakh rupees in Hyderabad. We made it in 2 to 3 lakh rupees in Karat. We removed such a large denting stone, melanoma, GBM tumor. I thought he will die. And I was supposed to write in the OT room, Kamjor dil wale yahan aana mana hai. I was saying myself, I consider myself to be very bold, but when I was working with that patient, I said, sir, it was Cherian who made us work. Otherwise, we said, sir, it's okay, Sastry. We can manage. Be cool. Take a deep breath. In. I said, say in and out. It's better to be out of the OT room. But then you see, we did it, we got the success. And that's what we say. This is called the neuroplasticity. So wherever you see the disruptions which is attributed. So what is what do you mean by disruptions and communication pathways leading to an imbalance in control of the muscle activity? So this is a disruptions. This is a pathway which has been damaged. एक बार कोई चीज डैमेज हो गया, रे मन दागा प्रेम का मत तोड़ो झटका जोड़ने से भी ना जुड़े जुड़े तो गांठ पड़ी जाए. And yay, this is the problem. The spasticity is the knot between the two strings. So it is said, don't break the love, the bond of love. Once it is broken, you will never understand how to make it reassemble, neuroplastic, and you cannot recover. So we have to focus on the recovery of the patient. We have to take the initial lead so that these things do not happen. So there is an imbalance in the control of the muscle activity, you see. There is an imbalance. This is the word which you have to understand. This imbalance. It may impact the stroke, survivors' mobility and independence and quality of life. It can cause muscle stiffness, pain, difficulty with movements. So everything is difficult. He is totally dependent. He may be out of wheelchair, but his life is what? A wheelchair patient. He can do nothing. So much pain, so much stiffness. And the problem is that his brain is never active to take decisions. He will see most of the stroke patients keep crying, they cannot leave. And that's what I took as a challenge. Mama, she's okay, ma. Thank you. She's okay. Thank you, ma. Ma, somehow we are managing it without any psychological drugs because I know after 7 days she will be okay. So I don't want to give her any such medicines which will destroy. So I just said, talking with ma, she will take out all our frustration, feelings. And after 7 days, you see, ma, she will be very normal. I don't want to give her any sleeping medicine except some mild sedative to make her sleep. No, we will give ma at night. But I'm sure she will be able to sleep naturally because mind needs sleep. After some time, she will sleep. How much they will think? Mind becomes tired after thinking, and he will sleep. No, not me. The mind will become tired and she will sleep. Don't worry. We too will manage this case. These people wanted to give her heavy psychotic drug. I did not want it to give. I always try to recover a patient naturally. Son will come. Actually, every day is coming. Today he was there. Son cannot come because he is having a wife. He is having a kid. He is coming. Every day he is coming. He was there for 3 hours today. He was there for 3 hours. We'll manage it. It's just a matter of time. We'll manage it. She was with me for 3 months. We'll manage it. It's okay, ma. You come after 3 days, but you just keep talking to her. It is enough for us. She wants someone's company. So I said, so she will give her company. After the good company, she will recover. You just have to hear what nonsense is speaking. Okay, ma. Thank you. Thank you, ma. Thank you, ma. Thank you so much, ma, for helping me. Thank you. No, I'm taking the class. I mean, between the class, so I talk to you. Thank you. Okay, I'll do it. Oh, so nice of you. I'm really thankful and appreciated. Indebted for gratitude. So we got a patient operated and then she has become delirium. She's saying ghost, anything, everywhere. But I did not give her any psychiatric drug. I know it's a matter of time. And after some time, she will be okay. So what did I do? One of my old patients is her friend. I requested her, you call her 4 times a day, 5 times a day. And she started talking. And I'm sure, just by the conversation module of these two ladies, you will see she will be much better. Yesterday, when they were supposed to discharge, they said that she is unfit to fly. So many things they said. But they said you take it by ambulance. I brought the patient by flight. And I will say you can see the, what you call, the photo of the airport. And she was absolutely okay. So always what we think, in a manner we understand, if you don't know how to manage, it becomes unmanageable. And when you know how to manage, it is manageable. It all depends on us. Because today you took so many things, right? You learned so many things. But can you practice anything?
No. No, sir.
Yes. Why? Why you cannot practice?
Because matter of life, sir.
Huh?
Matter of anybody's life, sir.
Oh, method of
We
life.
can-
So what are you doing in the class? Go home. You people, the question is that you never dreamt of practicing. You are just hearing the class, coming and hearing the class. And what will be the benefit of this class? It's just, I call it what you know. Just improve your knowledge, but it is not helpful. It's just a theoretical for you. Because you never asked me, so what should I do? How should I practice? And then I say, you don't want to practice. A practitioner's mouth is never like that. I have seen orthopedic surgeon going to MISS, minimal invasive spine surgery. They never knew it. They are doing it. We are removing tumors from the brain. Deep inside, we are going and removing. We are doing live navigations. We also knew nothing once upon a time. We were even afraid to do carinotomy, to remove the skull. We were so afraid. Seeing a picture of the brain is very easy. But going inside the brain, having a cut and taking out the tumor with lot of surrounding vessels, make a mistake and the patient is dead. And we bring the patient safely. Because the question is very simple. You know what? You have created a difference. For example, there's one boy called Sunil who is just above you, Manish. How is he practicing? How he recovered basilar artery infarct? It is the most difficult infarct in entire medical, entire what you call all types of infarct. It is the most difficult infarct, basilar artery infarct. How Sunil is improving? How Sunil? How what is the condition of the patient?
सर आगे से चेंज है
कितना चेंज आ गया आगे से?
5 to 10%.
तो तुम्हारे हिसाब से 5 तो मेरे हिसाब से 20% है बिकॉज असेसमेंट इज रॉन्ग. कितने दिन में आया?
सर 7 days में.
So it is almost 20% recovery. If you make the video, I can show you how the patient has recovered by 20%. Without bringing the patient from the voice of the patient, he is looking after the spasticity, and I am looking about the small movements which he has come out. So this patient was in the coma, and Sunil has brought out him from the coma. It is called semi-comatose stage. He wanted to do, he did it. And after some time, he'll do much better. It's all your motivation. And not only that, one more boy has done. I forgot that day. One more has done recovery of the patient. So managing requires possible multiple approach involving rehabilitation, medication, and in some cases surgical intervention. So we generally avoid the surgical interventions in most of the cases. We manage it with various stem cell therapy and all. But yes, it can be managed, very well managed, and it can be what? Recovered. Hello. Yes. हाँ ये हॉस्पिटल का नंबर है. नहीं ऐसा कोई गया नहीं. So when you speak about ozone therapy and all, I was very happy that yes, they can do. But when I speak about this NIBS, it's the highest form of treatment. Because up to now, People do not know how brain produces chemicals. So when I wrote a book called Astrophysics of the Brain, the nuclear physics and the neurophysics, neurochemistry and nuclear chemistry, the integration of both, I realized, yes, we can do a lot of things. I also thought we cannot work so many things. But later on, I came to know, yes, a lot of things. But every step has to cover up with one step. And that's why step or take. So how will you do it? See, those who want to do don't look excuses. And those who look for excuses, they don't do things. Can you hear me?
Yes, sir.
The corticospinal tract is a major descending motor pathway. It comes from the brain to the lower muscles. And that is not your fault also. Actually, the problem is that you have not studied medical science, you have not what you call it, you have a lot of doubts. And definitely it is supposed to be there. We appreciate this. Because any physician, you will know that this is what? This is the primary thing which he must know. But even if he knows, he is not able to recover. Why? Because there is no way by which this motor pathway can be what? Repaired. So whatever you are doing, physiotherapy, everything is correct. But are you repairing the motor pathway?
No.
Are you repairing anything? Is there any internal recovery inside the patient? Huh?
No, sir.
Then the rest is what? Until you recover the patient from inside, until the tracts are reformed, and it is very easy, I tell you, it is nothing very big. If it was a complicated thing, I would have said it is a complicated thing. If you tell me to teach you surgery and anastomosis, I would say it is very critical. Here, just place your finger, you put the needle inside, and you start from a trigger point. You just start treating from a trigger point, and you will see within few days, you will master this technique. One trigger point will teach you hundreds of things. The trigger point is here, over your shoulder, and you insert a needle and stimulate it, and you will see what? Cars. Within the seconds, the pain is gone. Within 5 seconds, the pain is gone. That is the motivation. And then when I speak to the neurosurgeon, sir, what is your opinion? I have nothing to say. And then we see, it is the power of the brain which can do a lot of things. Hello? Ah, yes. You Neuro Hospital, Hyderabad. Line cutting. So this you see, within 10 seconds I realize it is the correct signal or the wrong signal. So the moment you put any signal inside the brain realizes it is my signal or not my signal. It's just like you. You see your wife or it is not your wife. The moment you understand it is not your wife, what will you do? Will you kiss other's wife? Sunil?
No, sir.
Huh? The neurons will not have any connections because they are not tuned to it. The tuning inside has to be the tuning outside. If both are same, the connection will be same. So neither you have treated the pain properly. If you ask as a physician, I say we only give blocks, we give steroids. Are we treating pain? Radu, we are not treating. Because the patient who was operated here today morning in Karat, she was already given a number of blocks. Her kidney was damaged. She is high diabetic. And after that also they gave a steroid block. and they were scared, putting a stent in the heart, in the utera, and then they said surgery cannot be performed. I just said, Emmanuel, I am writing a poem about you. And I'm sure after 1.5 hours, I'll see the success. And in 2 hours, the pain is gone. The patient is mobilized. This is what you have to understand. Only you have a fear in your mind, nothing else. And that fear is your unknown. What will happen? I cannot play with the life of others. Bhaiya, who told you to play with the life of others? You are not at all playing. So what you will play? To play a football and you want to do a goal, you must play. You must learn from the hockey. You must play. Then only you will become a champion. Without touching a chessboard, you want to become what? World champion. It's a dream. So, it originates in the cerebral cortex and projects down through the brainstem and spinal cord. Ultimately, the controlling muscles throughout the body, the corticobulbar tract, are closely related pathway. Controls the voluntary movements of the face, tongue, and pharynx. So wherever you say, especially in the MND disease, the corticobulbar tract, or you will see in the post-stroke patients, people are not able to move the tongue, face, pharynx, they are not able to swallow. So this pathway is stemming. So whenever we go in the coma room, whenever we say, we ask him, or show your tongue, catch the fingers. So we understand if she is able to show, she is able to show the cheese. We realize the corticobulbar tract is okay. So there are two tracts. What are the two tracts? Corticospinal and corticobulbar. Right? This is the corticospinal. And this is?
Corticobulbar.
These tracts are crucial for motor control and are often affected by the stroke. Damage to the corticospinal and corticobulbar tracts can lead to weakness, spasticity, and control of motor impairments. Understanding the role of these tracts in post-stroke recovery is essential for the developing an effective rehabilitation and strategy. So now you have learned all these things. What will you do? It's like you have learned something in mathematics, and if you don't practice tomorrow, what will you do? For example, today I have tested this board, and almost in 1 week, I forgot how to use it. Just 1 week back, I was quite acquainted. Now you see, I forgot. Today again, I have to what? So now we have to understand about the vestibular and pyramidal tracts. So whenever we speak about acupuncture and all neuroacupuncture, we must understand all these tracts. Now, if you understand these tracts, we don't need to understand very much in detail about the tracts. But one thing we must understand about this tract is that if these tracts are not recovered, if the path is not recovered, whatever treatment you do, let you put the patient in 10 years physiotherapy. If the tract is not recovered, patient will not recover. The signal has to go to the brain and brain has to send the signal. I mean, these altered signals, if the signals are not correct, nothing will happen. What you see is not correct, because after some time you'll see the patient is dragging, but after some time you'll see is more dragging. Now dragging is improved, but because of the pressure on the joints have degenerated. You'll see avascular necrosis, osteoarthritis, and other lot of problems you will see. And then what you will find? Non-recovery in a patient. So balance, motor control, stroke, vestibular tract can lead to spasticity, affecting a posture. Gait, the overall movement. Understanding the role of the vestibular system in spasticity development is a key targeted to therapies. So this is what the most important part we must understand. Vestibular tract dysfunction. So I told you, when you have purchased a 3 more pain, when Sunil purchased 3 more pain, I said, yes, Sunil, you did the right thing. I can teach you another advanced mapping. What? You have to put your finger in just 35 degrees or 40 degrees, and then you just, what? Stimulate with this pain and this tract. What? The dysfunctioning of the is coming up. The paralysis is over. So up to now in medical science, there was the biggest, no one read it. Yesterday when I was reading the book, I think most of you people don't follow me in the Facebook. So when I wrote, why I wrote each chapter, I gave a reason. In writing that book, I found that people don't know what they are doing. You are speaking big things, this exercise, that exercise, PNF movement, that movement. But where about what is happening inside the brain and how it is happening and what will happen? Did you analyze? Rather, if you start from the central nervous system to the nervous system, PNS, CNS to PNS, and PNS to CNS, if you correlate this signals properly, what will happen? It becomes very easy. You really enjoy boys. After some time, you see, every mistake will make you what? Whatever you have done. It will correct you because you started playing. Once you started doing things, you will recover. You'll be much confident in presenting your paper. You'll be much confident when people are speaking to you because you understood what is the wrong. So the moment you see what is the wrong, you recover that wrong. So there is only two things in the English word, wrong and right. So whatever is wrong, if you make it right, that problem is solved. Why we are not able to solve the problem? Why we are afraid to learn? Why we are afraid to study? Tell me why. Because you think that this is not possible. And when I go, I say, everything is possible. Let me sit and do. So you will see there are two categories of people. One wants to recover, one does not want to recover. So one will always say, going there is so difficult, this. He'll always see of the difficulties. You'll always find problems in his solutions. There are two types of people. One person is only problem creator. You only think about the problems. And one is a person who will always try to find a problem, but he will solve it. Those who only think about the problem, that is a human life, how can I do it? Who's telling you? First, try to build up things. When will you build up? During your classes, you will build up. During your question hours, you will build up. When you do things, you will build up. How am I building up? How am I managing phones? How am I managing karate? How am I managing so many things? हाँ ताऊ जी, हाँ ताऊ जी, प्रणाम। बस ठीक है ताऊ जी, आई एम गुड। नहीं ताऊ जी, हम तो कल कराट में था ना, महाराष्ट्र मेडिकल कॉलेज में था। 6 दिन ना मेडिकल कॉलेज में था ताऊ जी, महाराष्ट्र। आज हॉस्पिटल पहुंचा है। हाँ, आज ही पहुंचा है। हाँ ताऊ जी। हाँ। अच्छा ताऊ जी। हाँ सुन ताऊ जी। हम्म। न्यूरो साइंस इंस्टीट्यूट कलकत्ता में, राइट, हाँ है। और ट्रिकोस्टोमी किया है, और ट्रिकोस्टोमी बोलते ताऊ जी उसको। है। नहीं नहीं ताऊ जी, इस पेशेंट को क्या हुआ, ब्रेन स्ट्रोक हुआ है। ब्रेन स्ट्रोक होने के बाद उसको वेंटिलेटर दिया है। वेंटिलेटर से निकालने के बाद वो ठीक से उसका लंग फंक्शन नहीं कर रहा था, तो हम लोग उसको पूरा जीवन वेंटिलेटर पर नहीं रख सकते। इसको उसको ये कर दिया, क्या बोलते हैं, ट्रेकेस्टोमी कर दिया। अब ट्रेकेस्टोमी करने के बाद क्या हुआ, पेशेंट ऑलरेडी ब्रेन स्ट्रोक में है, इसको सेमी कोमा स्टेज बोलते हैं हम लोग। कोमा नहीं, सेमी कोमा। कोमा और एवेनिस के बीच का स्टेज है। ताऊ जी ये निकाल सकता है, बट इसके पीछे काफी वो होता है, मेहनत करना पड़ता है। क्योंकि अगर अभी आप निकाल दिया और पेशेंट का ऑक्सीजन लेवल कम हो गया और CO2 लेवल हाई हो गया, एबीजी बोलते हैं जिसको हम लोग, अगर वो हाई हो गया तो पेशेंट कोलैप्स हो जाएगा। हम तो समझ गया ताऊ जी, सामने वाले को ये समझना है कि क्या करना है। ये सब केस नॉर्मल चीज है ताऊ जी, हम भी तो ठीक हो क्या है, आपके सामने भी तो गला में पाइप डाला था। आपके सामने तो गला में छेद किया था, तो निकल के आके पढ़ा नहीं रहा क्या, अभी भी क्लास ले रहा है। कल 3 सर्जरी करके आया, ब्रेन का और स्पाइन का, क्या प्रॉब्लम हुआ? कुछ नहीं आता ताऊ जी, ठीक हो जाता है। एक बार उनको बोलिए उनका सारा रिपोर्ट, MRI, ये सब भेजे। ताऊ जी उनको बोलिए आधा 1 घंटा के बाद फोन करें, 10 बजे के बाद, हाँ। हाँ हाँ। खाली आप थे इसलिए फोन उठा लिया, नहीं तो अभी हम फोन नहीं उठा पाते, क्लास में है। हाँ हाँ। हाँ ठीक है ताऊ जी, आई रेस्पॉन्ड। हाँ आप बोल दीजिए, आपका नाम बोल देगा ताऊ जी, नाम तो याद नहीं रहेगा। हाँ। आपके ताऊ जी से नंबर मिला था, बस हो जाएगा। आई डू इट ताऊ जी, हम सब समझा देगा उनको। हाँ ताऊ जी, आई डू इट। मच ऑफ ताऊ जी, बहुत बहुत धन्यवाद। हाँ हाँ, मैं आपसे बात करेगा, गिव यू फीडबैक ताऊ जी। हाँ हाँ, बहुत बहुत धन्यवाद ताऊ जी, मच ऑब्लाइज्ड, रियली ऑब्लाइज्ड ताऊ जी, थैंक यू ऑब्लाइज्ड। ऑब्लाइज्ड ताऊ जी। हाँ ऑब्लाइज्ड। See, when my concepts are clear, anytime the patient speaks, is my uncle, but he speaks something, I immediately got up that this patient is having low GCS, this thing happened, and this is called a major stroke, and she was on intubation, and then he said something, I grip up everything. Without seeing the history, I'll see the patient and I can speak what has happened, what medicine she was taken, what she is taking, all I can tell. But if you ask me 3 years back, was it possible? No. So this is what you must understand. When your foundation is clear, you can understand everything. But when your foundation is not clear, thing, for example, you studied homeopathy, right? And if you don't practice Ayurveda, what will happen? Sunil, if you study Ayurveda and if you don't practice Ayurveda, what will happen?
No, sir, nothing.
Huh?
Nothing.
Yeah. You study something and if you don't practice it and if you don't understand it, When will you understand? When you go to the practical part of it. And don't think that Sunil knows me from a very long time. He just knows he has taken only 15 days class from me. That's it. In 4 months or 5 months time, he has just learned 14 days. Not much more than that. He is not my year-old student. So we are speaking about the pyramidal tract. So pyramidal tract is responsible for voluntary movement, and this pathway is responsible for impaired motor control. So now you understood the corticospine vestibular tract dysfunction and the pyramidal tract dysfunction. The vestibular system plays a crucial role in balance, coordination, and motor control. So if you see the patient is not balanced, is not developing into balance, so what do? You take it at 50 degree or 40 degree, use the which muscles are creating disturbance. So when you ask me and you send me the report, I can see and I can realize, the video, these muscles are not working. Put your fingers on 50 degree like this. These are the muscles. This is an elbow, like what you do in sujo. I just made it like that. And whichever muscles are weak, put your hands on 50 degree, put the needles and stimulate. You'll see within 5 days, 7 days, the results are out. The balancing will come. But when we see the medical system, modern medical system, we have no way to recover the patient. We have to keep suctioning, we have to do this, we have to do that. That is why I say, if you find such patients, if you don't know how to treat it, even I say to the neurologist, if you don't know how to treat it, please don't treat it. And they say, sir, we don't treat it. We only give Botox and we give cardiac medicines. That's all. We don't do much more than that. We also know our limitations. We don't want to burn our fingers. For example, let us see this whiteboard. I knew nothing 7 days before this whiteboard, right? But now every day I'm learning something. And after 1 month, I'll be an expert. I knew nothing about Zoom, but from Zoom to here, from podium to here, how to manage things, I've learned now. While teaching, I'm learning. So, this is a pyramidal tract which leads to spasticity. And this is the vestibular tract which is responsive, which can lead to spasticity. So, it is both the pyramidal tract dysfunction and vestibular tract dysfunction. So, if you put Botox, will it recover? No. After 2 months, again the same thing. हेलो कौन बोल रहे हैं बोलिए सर 12 जुलाई को ठीक है बताइए सर ठीक है तो कोई बात नहीं है ऐसी तो कौन बात है ठीक है स्वामी आपको मेरा नंबर कहाँ से मिला अच्छा हाँ अभी क्या स्टेटस है पेशेंट का राइट ट्यूब दे रहे हैं ठीक है हाँ वो राइट ट्यूब में कोई खास बात नहीं तो अब मेरे से क्या मदद चाहते हैं ये मेडिसिन वाइज तो कुछ भी नहीं कर सकते पेशेंट अगर हाथ में हो तो हम उसको रिकवर कर सकते हैं पेशेंट बिना हाथ में हुए हम लोग कुछ भी नहीं कर सकते ये हैदराबाद बिना एडमिशन के तो कोई भी कुछ नहीं कर सकता इस केस को पेशेंट स्टेबल होगा जब रिकवर होगा तभी तो आगे हम सोचेंगे जितना जल्दी हो इट इज नॉट ए फॉर्मेलिटी इतना जल्दी भाई पेशेंट का ये मोटर मूवमेंट तो कोमा स्केल से बाहर आएगा अभी तो कोमा स्केल में पेशेंट ट्रेकेस्टोमी का मतलब है कभी कुछ निकल नहीं पा रहा कुछ नहीं कर पा रहा तभी तो ट्रेकेस्टोमी में सर मुझे पढ़ाएंगे क्या? मैं न्यूरोलॉजिस्ट हूँ, तो मुझे नहीं मालूम क्या क्या करना है। मुझे ये मालूम है कि उसको ट्रेकेस्टोमी लगा क्योंकि उसके स्वेलोइंग कैपेसिटी ये सब चली गई। अभी वो सेक्रेशन हो रहा है उसको निकालना होगा। अगर सेक्रेशन नहीं निकालेंगे तो वो होगा। बट ये कितने दिन करेंगे हम ऐसे? ये तो ये 2 साल तक रह जाएगा। अगर आप चीजों को अभी से ठीक नहीं करेंगे तो ये 2 साल तक रह जाएगा, 3 साल तक रह जाएगा। और अभी तो आपको खाना पाए वो नाक से जब देते तो आपको बी हैव टू बी केयरफुल कहीं वापस निमोनिया नहीं हो जाए। सबसे बड़ा प्रॉब्लम होता है इसमें एस्पिरेटेड निमोनिया। आपको मालूम है एस्पिरेटेड निमोनिया क्या होता है? आप जब नाक से देते तो लंग्स में पानी चला जाता है, और लंग्स में पानी जाने के बाद फिर पेशेंट को वेंटिलेटर पे डालना पड़ सकता है। तो आपको थोड़ा सावधानी बरतना होगा, एंड यू हैव टू बी केयरफुल विद द पेशेंट। बाकी ये सब पेशेंट ठीक होते हैं, प्रॉपरली सही तरीके से इलाज हो तो ठीक होते हैं। अगर आप ये सोचते हैं कि ये जो दवाएं दी है तो हम लोगों ने तो वो ब्लड थिनर्स और ये कार्डियक मेडिसिन दी है और एक बैक्लोफिन दिया है, उससे तो पैरालिसिस ठीक नहीं होता। हम्म। ठीक है। हाँ ये प्रॉपर हैदराबाद सिटी है। हाँ ये हाईटेक सिटी है। You see, this should be a knowledge. Can you hear me?
Yes, sir.
Yes, sir.
Sir.
The moment you see, he's saying me something, उसको कफ निकालने के लिए ट्यूब दिया। अरे white is nonsense. The tube is given for his oxygen level. When you remove the tracheostomy, you will put what? When you put a tracheostomy, it helps you to breathe in. He's breathing with the help of tracheostomy. So you'll put the patient like that is for the long time. That's what will happen? Tell me. What is the reason of his death? Tell me. What is the reason of his death? Tell me.
Aspiration pneumonia.
No. Aspirated pneumonia second, Sachin. The most important part will be DVT. Deep vein thrombosis. In 70% of the cases which I have maintained, I do not find ARDS as a complication. Only if your neck movement is not proper, then in 1 or 2% of the cases, in tracheostomy, it becomes ARDS, right? Acute respiratory distress syndrome, right? But in 95% cases, you don't find this complication after tracheostomy. Only suction has to be done properly. The post-stroke spasticity is a neurological disorder marked by. Now, for example, I don't have this pain and I'm moving it fast and I don't know. Nothing will come. I'll just move it and nothing is coming. Now I know it how to move. You see, the neurological marked by the increased muscle tone and involuntary muscle contraction profoundly impacts the motor function. The hypertonicity and resistance to movement directly affect the mobility. So whenever you are trying to move, there is a resistance. You cannot have see, oh. So when you are giving stretching over this, you are overusing the muscle. So what will happen? What will happen, Power? If you overuse it, you forcefully move the muscles, what will happen?
There is damage of neurons also. And
Yeah,
it will-
everything is damaged from the part to the brain. And the result, more spasticity. Hello. 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 So the first thing is that we take paralysis as a very casual subject. Second thing, we take all the medical subject as casual subject. We take it very casually. For example, yesterday we found delirium with the patient and they say that this patient cannot be given fit. And I brought it fit and I brought it to Hyderabad. 3 hours journey from Kolhapur to airport, Karat to Kolhapur, Kolhapur to airport, airport to Hyderabad, Hyderabad to this airport was 6 hours journey. And patient was absolutely fine. But if you would have seen the patient previous night, it was very difficult. And you know what did I give? Only they gave very high dose of those things. I only gave her what? I advised them to give only 1 ml of metazolam and 1 ml of diazepam. Half ml of diazepam. Not only less than half ml. 0.25 ml of diazepam with 1 ml of metazolam. That's it. At morning, 5 o'clock. Patient was well aware. Anxiety level was reduced. Corticospasm tried. Cortisol level was low. It was maintained. But otherwise, they were thinking to manage the brain. I was reducing the what? Stress hormones. So whenever you treat any patient like this, wherever there is hypertonicity and all, you see the stress hormone goes high. What it goes? The stress hormones goes high. And what will happen? Three things you must understand from today. It is the activity of the brain, the roads of from hand to brain and brain to hand is damaged. The speaking power, the throat is called another power, corticobulbar, right? So if these tracts are damaged, your muscle activity will go down. So it is the part of what? Motor neuron disease, neuromuscular disorders. It is a part of higher spasticity. It is a part of pain disorders. It is a part of what? If you know all this properly, you can even recover what? A great level of GI system. You can recover it. But just playing with the what? Stress hormones. If you reduce and cool down the brain, what will happen? Automatically the things will get settled. 80% of the things are settled by the stress hormones. Hello? 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 For example, I'm seeing the patients, I'm talking over the phone, I'm able to diagnose. How did I learn? Because my concepts were clear. I continued making my concepts clear. So now when I go there, anywhere, my accounts concept is clear, everything is clear. What happened? There is no tonicity here. I try to resolve the problem. So the problem is what? The problem is the path. And if the path is repaired, and path can be only repaired by a proper signal generation. If a file, it is just like a government file. If it goes very fluently to the Prime Minister, and from Prime Minister, if it comes down properly, what will happen? The channel is executed. So you just understand, a file from PM, Prime Minister, what you call, clerk to the Prime Minister, and Prime Minister to the clerk. And this is called the movement of the file. And if this movement takes place properly, so there is a proper channel of the movement. The clerk will forward the file to the superintendent, superintendent will forward the file to the deputy secretary will do the joint secretary to the commissioner secretary to the principal secretary to the additional chief secretary to the chief secretary to the CM to the chief secretary to the principal secretary, then the file will go to the cabinet. From the cabinet approval, again it will come to chief secretary, principal secretary, and down to the clerk again it will come. So same whatever the movement which you have taken place from clerk to the Prime Minister and Prime Minister to the clerk, it is same thing. the movement of the fingers. That is why I say, the people ask me as a mission director, how did I work? I said, I learned the movement of the finger. The neural basis of the movement of my finger taught me how to become a mission director. I understand how the files are moved. So now I can track the file. Wherever the file is going, I am able to track it. So the moment I track the file, moment I track the nerve, the nerve conduction velocity, muscular spasticity, so I am able to track it. The moment I am able to track, I can find out the recovery level. Hello? Hello? For example, if you would have become experts, if you would have started doing things very properly, this patient who was in Rajasthan, no need to come to Hyderabad, you could have treated him there. You can earn around 50,000, 70,000 rupees per patient. Who stops you? Money is not the problem. The problem is your own understanding. Because you don't know what is wrong. You do something called sujog, this. Baba, this will not help. Tell me one sentence in sujog which can influence the hypertonicity and resistance of the movement. Tell me one thing which can help you for independence, quality of life. And then secondary complication is what? Such as contractures, pain, joint deformities, and this is the biggest problem you'll find. What? Joint deformities. So if you recover the paralysis patient also, you come to a conclusion of what? Joint deformity. Avascular necrosis, hip osteoarthritis, slip disc, vagera. And this impairing mobility and increasing the risk of fall. This complication often requires extensive rehabilitation effort and may lead to physical limitation that persist long after initial stroking. So this is the line which you are taking from here. What are the three summaries you have learned? The tracks, there is the road. If you don't work, you will create all this secondary problem, comorbidities, severe pain, frozen shoulder, hip joint, knee joint deformities, ankle joint deformity, contractures, and then there is always what? Imbalance, risk of fall because there is a vestibular tract problem in the tract. So the patient is not able to balance. The moment is not able to balance, it will limit to what? Risk of fall. Whenever there is a risk of fall, there is a type of what? Compound fracture. So one problem after another problem is created. But if you solve the problem from the baseline, all these things are not created. So that is why I was laughing. After studying so much, we don't know what is spasticity, what is paralysis. We spoke so many things, ultra microsurgery, so many things we have to speak. But when we come here, why we have nothing to speak? Tell me. While doing surgery, we have the best equipments, best training. But when you come here post-surgery, what is the training you have? What is the recovery you have? Radhu Baba. That part you have to understand. You have to train yourself. No one is going to train you. No one is going. It is you have to train yourself. It is you who have to study. Because up to now you only studied. We only helped you to study. There is no one to teach you. We are just giving lectures. It is you who have to study. It is you who have to understand. And when you try to understand anything, it's very simple. recover the path. Everything will take place. So, to give proper signals in a proper direction, proper way, and topic, all these things are not there. Yes. It is one line topic. Disruption of signal, correct the disruption, neuroplasticity will take place. Topic, over. So, Sunil, I am coming to 4th. Everything is okay there?
Yes, sir.
4 तारीख को सब ठीक है ना? फिर कोई चेंज करवाएगा तुम अपना डेट?
नहीं सर।
लो, तुम्हारा ससुर जी का फोन आ गया। तुम्हारा ससुर हमको फोन क्यों कर रहा है सुनील? देखो,
आपसे बात करनी होगी सर।
दिस इज कॉल्ड द प्रेजेंस ऑफ माइंड। हेलो, हाँ, यस, MK शास्त्री। हाँ, शर्मा जी बोलिए। हाँ, ठीक है, कोई बात नहीं। हैदराबाद हो सकती है। हाँ, यहाँ पर कुछ दिनों के लिए आना होगा तो ही ट्रीटमेंट पॉसिबल है। ब्रेन को जब तक आप सही तरीके से ट्रीट नहीं करेंगे, ब्रेन रिकवर नहीं होगा। चलिए, तो आपकी कंडीशन के ऊपर डिपेंड करता है। बहुत सारे पेशेंट 15 दिन में, 20 दिन में, ब्रेन के ऊपर है। ब्रेन तो मेरे बस में नहीं है। आप मेरे को व्हाट्सएप पे हाई लिखिए, एड्रेस और लोकेशन में अपने आप आ जाए। आप कभी भी लिखिए, 2 साल बाद भी लिखिए, तो क्या फर्क पड़ता है? कोई बात नहीं, आ जाएगी। चलिए, भगवान आपका भी भला करे। चलिए, आपका भी मंगल हो रहा है। ठीक है, थैंक यू सो मच। See, because of my activities, I get phone calls from France, Italy. Near you, I have received 4 calls from Rajasthan. Baba, where is Rajasthan? Where is Hyderabad? Where is high-tech city? You are not known locally. I am known in Rajasthan. And 4 different areas of Rajasthan. East, west, north, south, central Rajasthan. Near you, I have received 4-5 calls. 1 call from Kolkata, 1 call from Italy. And I am taking the class also. That's the beauty of the task. That's why we learn what? Neurosurgery. We learn the balance of the fingers. मुझे इस पेन से सीखना होगा तुम्हारे दिमाग में कैसे सिंदूर भरा जाता है। एकदम परफेक्ट, ये देखो बढ़ गया। हाँ, गाला जी के दिमाग में सिंदूर भर गया। They should be perfect, right? Things should be perfect. If things are not perfect, you see what will happen? You see a pen is in my hand, but you don't see a pen in the picture. This is the magic. There is a signal, but you don't see a signal. You don't understand what is a signal. So what do? You observe the signal. You see, Chandran was very intelligent. The moment he found time, he immediately came and learned it. ले भाई, तेरा दूसरा ससुर का फोन है, राजस्थान से ही होगा। मनीष का फादर इन लॉ कॉलिंग मी। हेलो, हेलो, हाँ, यस, हाँ, यस, न्यूरो हॉस्पिटल, हाँ। So you see, this is a paralysis patient with voice aphasia, but he was only able to say, Bhavanara, how are you? Bhavandi. I understood this is a paralysis patient. So after some time, you'll become so expert. In 2 minutes, you will realize, oh, he does not want treatment, he's just wasting my time. For example, I spoke to Chandran. What is his specialty? He says, I am a person who removes what? Once your paper is laminated, I can delaminate and I can give you that paper and I can say it is done by me. And legally it is required because laminated papers are not legal papers, especially the will papers. Right? इसमें आपकी वो लिखी हुई होती है वसीयत. So I said,
Okay, compliments, sir.
so it is something like what you have to do. But if you don't do, yes, it's a dream. If you don't study now, if you don't understand, you won't submit your thesis next year. How will you get your fellowship? How will you go to international level? What is your recognition? If you cannot recover a patient, what is the benefit of study? When you cannot solve your middle class in just 2 minutes, the knee pain should go away. Treatment will follow up, but the pain should subside. First is the pain. When you cannot recover a cancerous pain, when you cannot taper fentanyl and morphine, what is the benefit of your knowledge? There is no specialization. Hello. 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 You see, in 5 seconds, I understand whether I have to receive the phone or not. How fast is the processing of the brain? If you give it, if you don't give it proper signal, it will what? Reject it. It's just like me. In 5 seconds, if you don't respond, 6 seconds, if the signal, they don't speak. My receiver says, cut down. I decide to receive a phone or cut a phone in less than 10 seconds. And this is the high I learned from NIBS. If the NIBS is not working in 10 seconds, my pathway is wrong. My pain is wrong. My signals are wrong. Go and study back to your table. Today with when I was in, you can see my photos with what? Cherian. All the neurosurgeons in Karad and everywhere who comes to him are afraid of him. And I am not afraid. I go to his room. I take his coat. You see, I gave a very good lecture wearing his coat. I said, so it was beautiful. I wore it. He said, you want to take it? I said, no, I don't want. I just wanted to enjoy. I enjoyed it. So your shoes are very good. I want to wear and do a jogging. I'll do it. Because of knowledge, honesty, and integrity. The problem with us is what you know, we are only self-centered. The moment you remove self from you, you come to the center. Only the problem what I saw in Karak, everywhere, wherever I see, even when I talk to you, I only found one problem. You know what? Everything starts from you and you end it with you. मुझको क्या फायदा होगा? मेरा क्या फायदा होगा? And what I say? सबका फायदा होगा तो मेरा फायदा अपने आप होगा. After some time, you'll see 300 students in the class. You won't be able to talk to me. You won't be because the syllabus will go to higher level. Why? Because we are signing MOU with more than 100 institutions. With one way, I spoke to Chedian sir, and his entire part came where? Yes, neurosurgery coach, KIMS, yes, 7 institutions. Immediately 7 institutions became the part of one institute. That's what you must remember. Vidya Vinati Vinay Vinay Dadati Patratam Dhanatapitam Dhanata Dharma. Those. Because my planning was so good that when I went to Hyderabad, I went only with 10,000 rupees loan. I stayed there for 7 days and I only spent 3,000. I came back with 7,000, out of which 2,000 rupees was what, for distributing 500 tips. And only my expenses was how much? 500 rupee taxi going, 600 rupees coming. So 3,200 was my total expenses in Kerala. Rest I came and I refunded. So if you don't know how to do savings, see, you people are thinking life as a trader. Ramaniji said very important thing, the DMART, one of the chairman of DMART. He was taking a class in Liverpool. So someone asked him, sir, how to do trading? Share market trading. Na? He said, I have opened the accounts of my own children. And I said that, don't do trading, do investment. You all are just traders. The moment you will become an investor, you will grow. You must learn how to invest money. You must learn how to save money. You must learn how to. You can hear me?
Yes,
Yes,
sir.
sir.
Because I think everyone was free, so I thought no one is hearing me. Everyone is closing their, what do you call, cameras. So only I can see 3 or 4 faces. Only those people are eligible for certificates. So group 1 certificate I can issue to only 3 or 4 people. Because there's no use of giving certificate to everyone. So how many people are there? I only seen Mesaram, Sunil, Pokhar, Surendrayan Das, Sachin Pawar, Noami, bas. Only these 3, 4 people. Write down the name, Sunil.
So I am also there. Manish.
Manish, but you have not practiced anything, Manish. Learning is not enough. What did you practice? You show me what you have done. Show me of the one video of the patient what you have done.
Yes, sir.
Hmm? Because your facial expressions, your way of working, it speaks what you have learned. Learning is a beautiful thing, only if you want to learn. You see, I do multitasking. I manage Karat as a chief operating officer. I maintain Hyderabad. I am going to what? Take workshops. I am going to give lectures to hundreds of medical students in BMS, BHMS, BNYS colleges. So after some time, you'll see 2,000 students in this class. Where are you? Nowhere. So if you don't make your space now, tomorrow there will be no space in the society. I just give one example. There are hundreds of competitors. I never think I'm not a neurosurgeon when I operate. I never think I'm not a neuroanesthetist. When they were saying psychiatrist is required, I just went in the 4 o'clock in the morning. I said, give this little dose to the patient. And the patient, they were thinking to mobilize the patient from Karat to Hyderabad by ambulance. I brought the patient very peacefully without the medical clearance by flight. And she is with me now. And after 1 month, people say she will be psychologically okay, physically okay, until give a good bite. And you people say at 75 years, surgery cannot be done. We have operated on 82 years of patient and surgery is successful. Spine surgery is successful. Tumors are successfully evacuated. आराम से निकाला जा सकता है ट्यूमर को. Spine corrections can be done very easily. And then post-operatively, just you need to recover. Put the needle here. Stimulate. Topic over. Certificate is a decoration. You know, in my entire life, I have put never my certificate anywhere. I have never quoted my what you call only in this dress. Otherwise, people will steal my dress. Previously, many people have stolen my dress. So now I started putting the my MK Sastry DR. Because we go to OTU, my dress is gone. Now, for that reason, we write our name everywhere. In the pant also, in our what? Here also, when I go to Karat, I write my name in my slipper also. Otherwise, so many sleepers it will miss. So it's a very good competition, very good market, sustainable market, and growing market. Stroke patient, paralysis patient, neuro patients, never ending patient. Because after neurosurgery also they are going to come to the market. After this also they are going to come. But then we don't want to recover. Well, on the other day, when Sadasi was telling me a patient of his retinitis pigmentosa, a visual loss. So the parents are still thinking what to do. We have shown so many people, no treatment. Fine. I suggested them a treatment which I know has recovered myself and many people. But what happened? They are still thinking. And they will realize when the eyes are gone. And then the child is blind. It's all up to you what you want to do. I wanted to invest my money, not on my luxury. Right? I bought all this digital board, podium and everything. Now it's very easy for me to teach. I'm adding more things here. Your knowledge and your quality should be so good that person like Chileans would say, what do you want? Oh, sir, I was thinking of a mobile phone. Oh, please have it. Sir, it was a joke. He'll have it next time. You see my photos with him? You see my photo with Emmanuel, very good spine surgeon? I said, if you don't take photograph with me, I am not going to talk to you next time. Forget, I'll not talk to you. Go like this. Okay, come. Take a photo. And then I write a poem. And you have to read that poem. So this is what called relationship. Relationship has many stages. And you have to build it with many steps. गालिब ने खूब ही कहा है, आशिक ऐसी करो तो पागल ना कहलाओ, और जब पागल कहलाओ तो आशिक हो जाओ. आशिकी भी पागल की हद तक जाने का नाम है. एक प्रेम होता है, एक आशिकी होता है. जब तुमको इस सब्जेक्ट से आशिकी हो जाए, उस अल्लाह से आशिकी हो जाए, जब तुम्हारे उस परवरदिगार से तुम्हारे वो उसकी रहमत से आशिकी हो जाए, तो तुम्हारे अंदर वो जो ज्ञान आएगा, that is the only knowledge what you do. Rest, whatever we do is drama. Someone asked me, sir, what is life? I said, this is life and this is that. And in between, whatever you do is drama. But if you don't perform your role properly, you will reach nowhere. You see, up to now, where did you reach? What is all of your age? Take out your balance sheet and you see where are you. How much % did you grow? What is the percentage of growth you made? Are you growing by 20%, 30%? Radu. There is no definition of growth. Everyone is thinking someone else will grow them. Arey Baba, you only have to grow yourself. तुम्हारा बच्चा तुमको पैदा करना होगा. No one will grow your child. But that love should be for that subject, as you love your subject, as you love your child, as you love your God, as you love your wife. There should not be any impartiality between any three of them. So when I had no impartiality, I became a neuroscientist. I started learning about neurophysics, right? And nuclear physics. I combined them. Then I started learning about atom bombs and all, right? And this. And then tomorrow you will see, I'm already completing one book on AVACS, airborne anti-warning and control systems, and neuroscience, and implications of brain stroke. How can you analyze the brain stroke will happen after 5 years? There's my new theory, which I understand. And I call it AVACS. AVACS is something what you know? a flight where there is aerodrome above it. And when it is on the air, it can take pictures 600 kilometers before. It can identify globally from 600 kilometers which kind of flight jet is coming. So whenever American presidents and prime ministers they go, they are escorted by AWACS. Because they can identify things from 600 kilometers. And that's what you all should do. You should analyze, you should study, you should focus. No one taught me all these things, I tell you. There is no teacher to teach you because no one thought about it. Subodh Raju sir said me a very beautiful thing. There is a very big hospital in Hyderabad, AIG, the head of the Department of Neurosurgery. He said me very beautiful sentence. You know what? हम लोग को दाल चावल से फुर्सत मिले तो ना हम कुछ सोचे. Have to think like chariot. You have to go to that environment to understand. तो क्लास में कोई नया छोटा है? वगैरह?
यस सर.
लड़का कोई है क्लास का, कोई नया लड़का, जवान छोकरा?
नहीं सर, अभी तो कोई नहीं है सर.
सब बुढ़े बुढ़े है.
हाँ, सब बुढ़े हैं सर.
ले तेरी एक कमाई का सोर्स था वो भी तुमने चौपट कर दिया. सब बुढ़ों की कौन शादी करेगा बुढ़ों बुढ़ियों से? हाँ मुश्ताक अहमद, कुछ नए लड़कों को लाओ, शादी वादी कराते, थोड़े बहुत दहेज वहेज लेते हैं, उसका 10% 20% हमारा, 5% तुम रख लो, 5% वाकड़े को दे दो. हमारा बुढ़ापा तो कटेगा, वो जाने उसकी वाइफ जाने. क्या अहमद साहब, गलत कहा?
सही है सर, ट्राई करेंगे.
हाँ. So it's just in a light mood. It is said that if you think in a positive way, if you think in a nice way, nothing is impossible. Impossible always says, I am possible. There are two ways of reading impossible. It is impossible. And the same impossible says, I am possible. It's up to you what you study. ये सब विचारों का खेल. आपने सोचा क्या हो सकता है? मैंने 35 किताबें लिख दी. बोले सर आप किताबें कैसे लिखते इतना हेक्टिक शेड्यूल के बीच में? मैंने बोला मेरे शॉर्ट हैंड वालों का आपने नई टेक्निक अपनाई, मैंने पुरानी चीजों पर ध्यान दिया. I got one person who writes short hand, right? So whenever I get a time, I tell आज तुम रात को सो जाओ, सुबह सो जाओ, रात को मिलेंगे, 1000 रुपया मिलेगा. ठीक है सर, 2 चैप्टर लिखने, लिखो. पकड़ा, लिखो, मैं बोलते जाता तुम लिखते जाओ. उसने पूरा चैप्टर लिख दिया, 3 चैप्टर लिख दिया, 10 बजे से लेकर 3 बजे तक. उसने उसको टाइप करके दिया, मैंने उसको ग्रामर एआई में डाल दिया, ये डाल दिया, ये डाल दिया. तो बदल मेरा 3 चैप्टर खत्म. 5 दिन में मेरी किताब खत्म. अब मैं अगर तुम्हारी स्पीड से चलूं तो अगले जन्म तक किताब नहीं खत्म. और इतना लिख दिया मैंने, इतना लिख दिया कि तुम लोग एक किताब भी नहीं पढ़ पाओगे. मैंने तो 40 किताबें लिख दी. तुम्हारे अगले जन्म तुम्हारे बेटे पोतों के लिए किताब लिख दी. I have written books for your great grandsons, and I think they will also not be able to study so much I have written. Forget how much I have studied. But if I apply my intelligence and if I become smart, then I will be able to write. Otherwise, you see, Mustaq Ahmad Sahab, I just told him, I just wanted to know what he said. He said, अरे कोई नया लड़का है? बोला नहीं है. मुश्ताक साहब लड़के पकड़ के लाओ, उसकी शादी करवाते, 20% मेरा, 5 आपका, उसका. बंदगी में नेक किसी शायर ने खूब कहा है, अल्लाह की बंदगी को समझने के लिए भी अल्लाह की नेक अपने पड़ोसी को परेशान नहीं. जिससे वो इस्लामत आ जाएगी अंदर, वो पाकियत आ जाएगी. When your heart becomes pure, your mind will remain what? Away from this selfishness. And I am sure growth has no end, my children. Growth is only growth. So it is up to you. You want to do investment or you want to do trading. If you become a trader, you will be a loser. And if you want to be an investor, you will gain for your life. It's up to you. There are two things, trading and investment. This is the language of stock market. कोशिश करते हैं, अरे बोलने में, दिस इज हाउ यू स्पीक द एटीट्यूड. कोशिश करते हैं, सच क्या झूठ क्या वो बात की बात है, पर कोशिश तो करते हैं. When you try, you will get the results. घर बैठे रहेंगे तो सोचते रह गए. आप तो 2 साल से सोचते रह गए वरुण जी, क्या हुआ, जहाँ चले तो वही है. मैं तो कहीं से कहीं पहुंच गया. फिर आप बोलोगे आप में और मुझ में डिफरेंस है. क्या डिफरेंस है? मैंने अपने आप को फोकस किया. आप सवालों में जब उलझते गए, मैंने सवालों को जवाब देना चालू किया. बस आई स्टार्टेड आंसरिंग द क्वेश्चंस. यू जस्ट kept creating questions. That's the only difference between you and me. Buddha answered his questions. Jesus answered his questions. Muhammad Sahib answered his questions. Quran, Bible, and Gita was created. When you see Gita, when I wrote yesterday, the neuroscience of Bhagavad Gita and the sounds of silence, what I learned from Bible, Quran, and Gita, I found only one thing common in there. It's just a question and answer. मोहम्मद साहब के सवालों का जवाब उस किताब के अंदर है. जीसस के सवालों, the Bible is nothing but the question and answer between Jesus and his disciples. Gita is nothing but the question and answer between what? Arjuna and Krishna. That's it. You never studied Gita, you never studied Quran. You only wasted your time. And you wasted 40 years of your life. अब खाली तेरा तुर प्रयासा चेतब दिन छिप जासी. In Hindi it is said, "Oh farmer, get up. Your land is far. If you sleep now, the tigers will eat you up. You have to cross the jungle before there is night." All up to you, what you create. The life is your own. How you want to create, how you want to destroy. Even if I motivate you, nothing will happen. Motivation is inside. Someone asked me which pen I should buy. I said it is wastage of my time. So what I do? I give the name of Sachin Pawar, Sunil, Chandran. You ask them. Should you buy or not? That also you ask them. Why should I tell this answer? Because they also have the same mindset. Should we buy or not buy? They answered their questions. They got their reply. So those who got their reply, they should answer it. I got my reply, so I made it. There was a question inside my mind. How to talk to the brain? How can I speak to the brain? For example, if I want to speak to you, I need a laptop, I need this, I need an internet connection. Can you hear me?
Yes, sir.
Yeah.
Sir.
I need a webcam, I need this TV, I need a good light, what do you call, studio light. The corner room. All arrangements were made. But if you ask me, 3 years back, I had only one mobile. For 4 years, I taught for mobile. Now I'm purchased mobile after 5 years, but I am learning. I did it. I dreamt I did it. But I feel just very bad for you. You know why? How will you grow in your career? First, the day you realize, you'll understand what do you mean by career. Go and see. Additionally, what do you mean by a career? Where you started and where you are. And how much you could have done. I can earn 20 lakh rupees per month, 50 lakh rupees per month. But then I decided, if I become greedy, I cannot be a knowledgeable man. If I want to earn knowledge, I have to leave my greediness. And then I decided, what? I live a very simple life. So when I went to Karat and all, that simplicity of mind attracted people. Every person whom I speak, there is a neurosurgeon. And everyone is protecting to me. And everyone is supporting me. The top surgeons of the world are supporting me. And you can see my photos with Cherian.
Yes, sir.
The biggest joke with Cherian, you know what did I say this time? Sir, you call an advocate and just you adopt me. Well, what? So then I like MK Sastry, bracket Cherian. Then son of IP Cherian. Topic over, sir. All controversies over. So, after some time, I will be Sastry Cherian. Just, if you have a knowledge, people will respect you. If you have a honesty, respect will come. But if you have integrity, you will have blessings. If I wanted to earn money, no one can stop me from making money. Every month you can pay 10,000 to me. From 50,000, 5 lakh rupees I can make. But then all this is rubbish. I should earn from my own what? Guts. If I cannot earn from my practice, I'm not a right person. And still I earn 5, 6 lakh rupees, 7 lakh rupees with my only night duty. I do work day for free and night I work for money. So that's the spirit. I hope one day you will learn. Anyway, all of you, thank you so much. Om
Right, sir.
Shanti.
Thank you, sir.
Thank you so much.
Thank you, sir.
Thank you so much.
Thank you, sir. Thank you.
Thank you very much.
Thank you.
Thank you,
Good
sir.
night.